stroke is another arterial disease. It's only that now it affects the cerebral system or the brain. And normally when it happens, most people will just go quiet, depending on where it is. There's times that it affects on the side where there is speech, the other times it affects on the other. But there are three main things we ask people to do, to tell, whether you may be with somebody, whether it's with a friend or with a relative. If you suspect somebody is having a stroke, one of the things is, for instance, if you tell them to raise their arms, the side that has a stroke will stay there. So it tells, if you try to raise your arms and one arm stays down along the body, then you must be very worried. We call that, arm drift, arm drift. And this is something that can be used in the community level to diagnose a stroke. The other thing is to tell somebody to smile, and you'll see the mouth just shift. Tell somebody to smile, and the mouth will shift onto the side that is normal. The side that is paralyzed will stretch. It doesn't have any power to oppose, so the mouth will just be deviated. And the second one, if you tell the person to say something, it will be difficult. That's the third one. It will be difficult to verbalize. They cannot form words very, very well. Okay? So those three signs, if you see them, okay, then you should be highly suspect that you have a stroke, you're having a stroke. There are other things people might feel. Remember, when it comes to presentation, there are some people who may get a headache, the others who may faint, the others who may just now have manifestations based on those three signs that we've talked about. Once you realize that, this is one time you cannot take an aspirin, because there are two types of strokes. There's a stroke where the artery is blocked. That one you can take an aspirin for, but you cannot know. There is a stroke that presents in the same way, where an artery bursts and you bleed in the brain. And this happens to people with hypertension and even people without hypertension. So if you take an aspirin when it is a bleed, then the bleed is going to get worse. So that's bad. And sometimes we see people doing that. We see people coming to us, they just realize they had stroke symptoms and they took an aspirin and it gets worse. Others just, of course, get lucky. The thing to do is, again, to go to a hospital. And at the hospital, normally we do a quick CT scan of the brain, and we're able to tell, is this a bleed or is this an artery blockage? If it is a bleed, then we treat in a different way. Sometimes it may even require surgery to remove that clot. If it is an artery blockage, then again, time is brain. If it is within 3.5 to 4 hours, there are ways in which we can use the same clot buster, but the time here is short, 3.5 hours. If you come to hospital 5 hours later, we are not going to be able to use that. So if you suspect you're having a stroke, if you go to a hospital immediately, it's possible that you can be given a clot buster, and it may help to open the artery and therefore minimize your stroke or even abort it. But if you arrive after 3.5 hours, then you are given medication, which now includes aspirin, cholesterol medication, physiotherapy, rehabilitation, and people still do okay. But it's good to report very, very quickly so that you can put yourself at the advantage of having a clot buster used for you, because clot busters are much more effective in treating that kind of stroke.